It's me, Dr. Said Ali Kumail. I am working as an intern in Imam Khomeini Hospital, Tehran. Last week we had a patient, a 56 years old female. She was suffering from pelvic pain on the right side of the hip, and the pain was constant, pain was localized, and also she stated that from last 4 months she has experiencing this pain, and she was not stating any kind of previous trauma history, and also she was taking painkillers for this pain, and the pain was resistant to all painkillers. Moreover, in past medical history she was not having any kind of disease. In drug history she was not taking any kind of medicine. Only the painkiller she was taking for that pain was in the drug history. In habitual history she was not smoker or alcoholic or any kind of, she was not using any kind of opiates, etc. She was also not having any kind of allergic history, and she was a housewife, and that's why we cannot say that she in her profession she got something like intensive exercise or something. She didn't stated any kind of and extensive exercises or like that. But the most important point was that in her family history, her sister was suffering from breast cancer some years back. All the physical examination was normal, only she was having a tenderness on the right side of the pelvis. So when we did the x-ray, in x-ray we saw there was a kind of light lytic lesions on the right side of the hip. It was suspicious, so we go for MRI. In MRI it was confirmed that these are the lytic lesions due to some kind of a serious disease which can be malignancy. So we go for biopsy of that lytic lesions. Then when we did biopsy, we found out that it was adenocarcinoma, metastatic adenocarcinoma. Because her sister was suffering from breast cancer, we did mammography for her, and we found out there were some kind of irregular masses in the breast, and those irregular masses was suspicious, so we did biopsy for those irregular masses, and it was confirmed that it was invasive ductal carcinoma of the breast, which metastasized to the bone and become the adenocarcinoma of the bone.